Hi you guys, welcome back to my channel. So if you are new here, my name is Joy. I am currently in a accelerating BSN program at West Coast University. So I will be making vlogs of my nursing experience and advice dealing with my nursing experience. So if you are interested in those videos, please like and subscribe. So currently it is 9:46 Thursday, August 15th. I am going to my nursing corps orientation, and I'm so excited. I think anybody that's in nursing school, when you start nursing corps and actually getting the fundamentals of nursing and hands-on experience, I think that's what everybody is so excited to get to. I mean, general education is like, yeah, woohoo, but it's like we're talking and we're getting lectured all day versus like you're gonna be actually in SIMS lab or stimulation lab with doing hands-on experiencing, knowing different types of drugs, knowing different type of scenarios that you have to go through when you're actually on the floor or in the hospital. So I'm just very excited about it. I'm also nervous because I know they are going to be very, very strict, you know, because it's nursing corps, you know, obviously. But I will definitely give you guys details on that. Right now I'm currently heading to Dunkin' Donuts just to give me a refresher, and also like a little bag of what's it called, hash browns, just to put on my stomach because I haven't ate today. They said that they were going to feed us, but I don't know when they are going to feed us, and it's like from 11:30 to like 4:30, so I need to eat something now, so I have something on my stomach. The school is like an hour away from me. It's no traffic right now. Usually when it's like I'm going to school like at 5 or like early in the morning, like around 9, the traffic is like heavy, so it's usually like an hour away from me, but hopefully it'll be like 45 minutes. I haven't checked yet. But yeah, that's what I'm going to do, and I'll give you guys details on that after I get back from the orientation, because I'm pretty sure we can't record in there obviously. But yeah, I'm gonna go ahead and get some Dunkin' and put something on my stomach, and then I'll get back with you guys later.
Hello, welcome to Dunkin'. Will you be using your app?
Hello, can we get you started with?
Can I please get a strawberry dragon fruit with lemonade, medium?
Alright, what else today?
And then can I get 2 hash browns, and that'll be it?
2 orders of hash brown? Yeah.
Yes, and that'll be it.
Alright, you can pull forward.
Okay, so I got my order. Don't this look so good, y'all? And you know it's good because it's not light pink. I want it to be dark pink because that means that they put sugar in it to not water down. And then I have my hash browns, and I'm just gonna eat it on the way to I was trying to say work, on the way to the orientation. Yes, honey.
Hey guys, so it is Sunday. It is no longer Thursday, so it is a couple days after our orientation, but I've been like super duper busy with life, so I'm here now. I am just going to go over briefly a little bit of what was going on at orientation, and then also go through our skills bag, and then also the books that we did get at orientation. But just for starters, so basically orientation, it was just mainly information. We had different departments, like our dean of nursing, she was there. We had someone that was over stimulation lab, skills lab. We had our advisors. We had I forgot what specifically her role is, but she did help us specifically do our clinical packages. We had people that came in that would come see us at our clinical sites once we go out, just to make sure everything is good. So yeah, it was different departments just kind of explaining their role and what they do and what kind of resources we have going into nursing corps. But the main thing they were talking about was that obviously we can't miss that many days of core. I believe in GE, general education, we only could miss, I want to say 30%, but I believe this one is 20 or either 40, 30. I don't know, but we can't miss more than like 2 days, one at the most. We can't miss no clinicals at all whatsoever, unless there's documentation and paperwork showing the reason why we missed that clinical, and we have to make it up. From my understanding, I do start tomorrow, which is Monday, but from my understanding, just from orientation, I believe we have like a med math test, a ATI test, and then also like our general final at the end of our course test. So it'll be a lot. And I can go more into depth with that regarding the breakdown of everything, because again, I understood what they were saying, but I guess I have to be inside the class and start the class to give you more information regarding that. I do know for a fact she did state that med math we have to pass with a 90%. We can try 3 times within that specific term. If we don't pass it, then we fail the whole term, and we only can fail the term once. So if I would say twice. So like if you fail 1 time, you can retake it, but if you fail the 2nd time, you're excused from the entire course, entire school. So you have 2 tries, but you only can fail once, if that makes sense, without trying again. Also, they went over all of our they basically went over the simulation lab, how it works, and also the skill labs and how that works also. And then they did mainly go into depth with regarding our uniform and how we need to be presented and looked and dressed for clinicals, and also our skills. No nail polish, not even clear, no criticals, not criticals, no I forgot what it's called. It's not criticals, no acrylics, I'm sorry, no acrylics. We only can have stud earrings. We cannot have nose earrings, no jewelry at all whatsoever, no perfume, no makeup, no eyelashes, no lash extensions. Hair has to be up in a bun and out of our face. And then I believe that's about it. We have to wear white socks, white shoes, uniform. If we do want to wear a jacket, we have to get the jacket from our university. We cannot just wear just a different color jacket. If we want to wear a headband, it has to be black, white, or navy blue. And that's about it. So yeah, let me just go ahead and just start off. So we did get ATI, and they did kind of go more into depth with that regarding our regarding that. So we're using ATI to do most of our work, and they did give us a box full of different books that we have. And for this one, this is why this one's on top. It's Fundamental of Nursing. So this whole book, I'll be in that this semester. They have leadership and management, pediatric, community health nurse, nutrition for nursing, maternal, newborn, pharmacology, medical surgical nursing, and mental health, I believe. And then yeah, that's about it. The medical surgical nursing is the biggest book, but those are all the books that we have, and we'll be correlating with the term that we'll be in. So obviously right now, fundamentals will be the one that I'll be working in. I kind of went through all the books, so that's why this one's on top. So that's that. And then they also provided us our bag that we have, and we have to take this everywhere we go. As far as skills or simulations, we cannot take it to the clinical site, obviously, but yeah, it's only for skills in simulation. They said everything that we have in here we won't use for this term, so this will just be going with us throughout the whole term. But I'm just gonna go over briefly what we have. I'm not gonna go into depth because I'm not gonna lie, it's a lot of stuff. But excuse me. So we have this drug guide for nursing book that came in there, and then we have different type of pump infusion and secondary sets of pump infusion that we'll use. So we have different types of those items. And then we have I'm so sorry. And then we have a personal protection kit. So it's a personal protection kit that they'll show us how to put on and take off correctly. We have our stethoscope. They did advise that we could get our own, but I mean, I really don't really care. So I just probably would just keep this. It's no big deal for me to get one that I want or not. And then they have little extra ones that we can use, I guess, if the ear parts and then this gets old, we could just reuse it. And then we have stimulation education supplies. It has syringe, latex gloves, underpads, drape, 2 packages of swab sticks. So all of this is in this particular bag. All of this is in here. I'm not going to open it until we necessarily like need to use it. So we have sodium chloride, and then we have catheter, and we have this little injection stimulator. I think this is like the cutest little thing. It feels just like skin, and this will help us, if you can see it, like it's just like, it feels just like skin. And she said that we can use this to help us practice inserting syringes with this. And she said that once we insert it, then we'll have to open this up and clean it out so it won't get mold and stuff on it, which I think is pretty cool. And then we have dressing trays, and then we have chloride injection, little chloride injection bottle, if it'll focus, you guys can see. And then everything in this bag, I'm not going to specifically go over. It's like we have a lot of alcohol pads, scissors. This is our light that we have. We have a lot of gauze and stuff in here. And infusion pump. Yeah, more gauze. So it's like a lot of little tedious little things that we have in here. IV star kit, tape. So yeah, all of this is in this bag. I'm not gonna go through it. And then I forgot what this is called. I cannot remember what this thing is, but this is to help, you know, when you go to the doctor and they get you on your knee or your foot just to see if it can, if it'll flex. This is what this is. So I forgot the name of that. And then This is another, I forgot what she said, nasogastric subtubes. She said it turns on and off or something. I forgot what exactly that was. And then, oh, this is our, I'm like, what is this? This is our blood pressure. Is this our blood pressure? Yeah. This is for blood pressure. This is our blood pressure pump. It's in here. And that's about it. Those are all of the things that we have in the bag. Let me make sure. Yep, those are all the things that we have in the bag that we brought. And again, we only bring this to simulation or skills lab, which is every Saturday for me. So next thing that I'll do is go ahead and show you guys my uniform and everything that came in it. And then yeah, so give me 1 second. Okay, so this is the uniform. So I have just a medium top, and you guys know I go to West Coast, so it doesn't really matter if I show you guys this. So I have a medium top, and it has pockets here at the front. And then I don't know if you guys can see my pants. I have, let me see, I don't want to stand up on the thing, but I have medium pants. If you guys can see, it has like pockets on the side, pockets in the back, and these fit very, very good. Yeah, these fit very good. These are a medium also. And then what came along with it is, it looks like a blazer, guys, but this is actually the jacket that they want us to wear if we get cold. But I'm not doing that. This looks like very formal, and I'm not going to wear this. So I think I'm going to order one of the outfits that I have, well, one of the jackets that's online, that's another alternate that we could use. And then we also did get this white polo, and I got this in a medium as well, and then the medium in the blazer too. So this white polo, which I don't know when or where or why we would be wearing it, but we have 2 tops. So we ordered 2 tops, 2 bottoms, and then we did order this is a small to medium. This is the undershirt that'll go under here. If we get cold, we can just wear it, and it's navy blue. So I'm not gonna open that until Saturday, I guess. So this goes under that, and that's the medium also. So we have 2 tops, 2 bottoms, 1 undershirt, 1 blazer, and then one polo shirt. Guys, I had to get out of those clothes, but that's everything that we received and everything that we kind of went over briefly in orientation. Everything else was specifically for the classes, and I just won't give you guys that much information until I actually start and understand the flow and the process and everything. But I do start class on Monday online. So the semester starts, or the term starts on Monday, but we won't go to class until Wednesday, Thursday, and then we'll have our first skills lab on Saturday, and we're hitting the ground running, honey. We are hitting the ground running. But I'm very excited. I'm very, very nervous. I will be filming as much as I can for you guys. They do not allow us to have phones in the skills or simulation lab, and then we are not allowed to record anything as far as the lecture in lecture class. So I'll try to get as much as I can, and then I'll try to definitely explain to you guys as much as I can regarding everything, and show you guys my process and document everything for you guys, because I know whenever I started I wanted to have videos like this. So I know this is a little quick and brief, but I hope you guys enjoyed it and like it. I am going to get ready and try to straighten up and head to bed, because I'm gonna hit the ground running tomorrow, and I have work in the morning. So I'll see you guys tomorrow.